I was talking very early this morning about the InterCommunity Healthcare reports a dramatic spike in fentanyl. Tim Booth is with me this morning, and so is the head of the board of directors, Meghan Blanchette, and this is all about InterCommunity Healthcare. Their report, a dramatic spike in, and I'll tell you something, this is really something else, and I'm so glad that I've got Tyler and Meghan with me this morning. And Tyler, good morning, good morning.
Good morning to you.
And Meghan, how are you this morning?
I'm well. How are you?
I'm just fine. And you know, when I was reading through this, I said, this is Hartford, Connecticut. This is Connecticut, and this is going on. All I ask you is, how did all this happen?
Well, the fentanyl crisis is actually, I think, a byproduct of an ongoing desire on the part of the drug dealers of the world to try to get more people into their cash flow. So what's happening is that drugs that have never been safe but have been used for multiple years, opioids, such as heroin, are now being cut with fentanyl because it's 100 times more powerful than something like morphine. So by putting that extra powerful drug in with the heroin, it's far more addictive, but it's also far more fatal. A single drop of fentanyl can kill you. And so folks who historically have been able to maintain for a long time with a less powerful high on heroin are no longer able to do that. They're overdosing on their first use, or even if they've become regular users of heroin, once it's cut with fentanyl, that can kill them.
Tyler, is it true approximately 50% of patients treated for opioid addiction in July admitted to using fentanyl, knowing it would kill them?
That is correct. We run the largest detox in Connecticut. We help people detox from opioid addiction, benzodiazepine addiction, and also alcohol addiction. We have a 35-bed detox, and in July, about half of the people that came in for opioid treatment admitted to using fentanyl as the drug of choice. We're seeing people as they leave from the detox. We give them, as necessary, medication such as Narcan to help them recover if they were to use again. What's tragic is that many people choose to leave that prescription behind, and on the flip of that, we have many dealers who are actually giving Narcan out because it's a better high. So you can go use something that could kill you, have your buddy help you with the Narcan so that you can revive, and then you take turns. So the power of addiction really can't be overstated, and the number of people who are moving to using harder and harder drugs is a tragic reality that we're all dealing with in every community.
Meghan, you're involved in this. You're on the board of directors. When I read about this, I could not believe it was happening so quickly here in Connecticut. And I talk a great deal about it here in the morning. And just to know there are people out there that use this, knowing what it'll do. What do you think? What are some of your feelings?
So I'm actually a person in long-term recovery from opiates, and I can speak from my own personal experience that when I find out that there's a drug out there that is very, very potent, that's the drug that I go for. So I understand the mentality of the people that are in active addiction because I was in active addiction for a long time. I think that it's terrifying, but if I found out when I was in active addiction that somebody overdosed on a particular brand of heroin, I would seek out that brand because that meant that it was strong and that I was going to, get my money's worth, if you will. And it's so sick and it's so crazy, but it's the truth.
Are that many people in this state doing this, Meghan?
Absolutely. I think that it's gotten a lot worse in recent years. I think about what it looked like when I was a child, in my community, and I think about what it looks like now, and I don't know if it's maybe just because I have a heightened awareness because I've been through active addiction, but I believe that it's becoming much, much worse.
To put this in perspective, last year there was over 1,038 deaths due to overdose. 60 of those were in Hartford alone.
60 in Hartford?
Correct. of the 1,038 that died last year.
Wow. This is really at crisis proportion. And, you know, it's wonderful with what you're doing, what Meghan is doing, and what your group, InterCommunity Healthcare, is doing. But how can we beat this whole thing? Can we ever beat it? That's the question that I get asked me.
I think that's it's a very tough question to be able to answer as far as the way by which we will overcome this addiction. But what we realize by providing whole person health care is that just treating the addiction is not enough. You also have to treat the underlying causes behind the addiction and then look for a change of environment. So helping people after they complete a 3 to 7 day detox to go into a 90-day program or to go into a residential program and continue in talk therapy. There's other medications that can be used, such as medication-assisted treatment, which is a combination of medicine and talk therapy. That works for some folks. For many others, what it really is about getting away from the environment that they are likely to go back to in a shorter treatment span and go back to using. If we don't address what's underneath that addiction, if we don't treat the addiction as a disease, which it truly is, then we're not going to be able to overcome this.
Meghan, just one quick one. Have you beaten it? Can you beat it?
So I would never say that I'm cured, but I am in recovery. I've been in recovery for about 3 years now. The work towards my recovery is never done. I have to consistently be vigilant and stay, on top of my own mental health and my own everyday activities, making sure that I'm taking care of myself and staying healthy. But yes, I would, if it were a cancer, I would say that I am in remission. It could come back if I get, spiritually unfit or if I start to, do the wrong things again. However, I am in recovery now and I am loving every minute of it.
Well, I want to tell you, I'm going to have you both back on the program. We've got to do a program with the two of you and have our listeners ask questions too, because I know they're just as concerned as you are, as I am, and this is an incredible situation that we have in Connecticut, and I thank you so much, both of you, for sharing some time with me this morning.
Thanks for having us.